A little bit about our National Resource Center. We are funded by the Children's Bureau, and we provide technical assistance, training, consultation services to all the states and the tribes upon request. And our primary focus is on improving the decision-making that happens in the public Child Protective Services system. We do that in a lot of different ways. We provide advice on decision-making tools. We do policy work, and we have focused in the past few years quite a bit on differential response, and that is in response to requests that we have received, as well as the CAPTA legislation that was, when it was reauthorized a few years ago, that's changed to require every jurisdiction to begin the process of implementing an approach to differential response. So what I'm going to do today is I'm going to start off, I'm going to give you the national overview of what is differential response. In South Carolina, we're calling it appropriate response, which I think is a great thing to call it. But I want to give you a sense of what it is, why it has been seen as really a tremendous child protection reform effort. And Alicia's going to provide some crosswalk between what can happen with families that are identified and can be served through a differential response using the protective factors framework and strengthening families approach. So we hope that it's a nice mix for you of the way these two can come together. We are going to have opportunity for questions before we finish up. So if one of us says something and you want to know more about that, we can also make sure that you have copies of our PowerPoint slides if you would like them, and I'm happy to give you references to any kind of resources that might be necessary. All right, so I'm hitting the arrow button and it's not going. Just the space. Oh, there we go. Okay. All right, so what do we mean by differential response? When we talk about differential response, we're talking about a practice that allows for more than one response to families, that there are, we take initial responses, as Lillian said in her opening remarks. We get calls that come in about, oops, did it go back to? Okay, see if there's, going to stay there, okay. We take call. Are you doing that? All right. Okay, sorry, guys. Okay, technical difficulties. Anyway, one of the things that's important to understand about differential response, it is not an approach that is designed for cases that would normally be screened out. That's important because this is not about opening the front door wider to take in more families. This is about taking those families that would normally be accepted into the Child Protective Services system and would normally be investigated, and now we're saying we're going to take some of those families and we are going to do something different from an investigation. So it's taking in cases that would normally be screened in and making a different response with some of those families. That's an important distinction when we talk about differential response, because there's plenty, as Lillian said, there are plenty of prevention efforts that are happening across the country that are for cases that would not make it to our public Child Protective Services system normally. So a little bit about history and purpose. When you think back on what the Child Protective Services system is, it's really was established obviously many years ago to help us respond to all cases of suspected abuse and neglect. In the course of time, with the increasing stress on families and the diminishing resources in our public systems, I think it's fair to say that many systems have been overwhelmed. There's more cases. Every family that gets referred to us, we cannot, and I mean the Child Protective Services Agency, cannot take every one of those cases. Our caseloads are already maxed out with the families that we are taking in, so this is the reality of our system. It's also true that we screen in many cases that we end up not providing any services to. If you look at the statistics nationwide, you'll see that it's well over 50% of all the cases that get accepted in and investigated receive no services. They may even be substantiated or confirmed, and yet they receive no services. So what you'll see when we keep going through this presentation, that there is most of the cases that get now with this appropriate response, we're serving many more families in the long run. We also know that in a traditional CPS-type investigation, it has a tendency to be rather adversarial. We show up unannounced, we go to the school and we talk to the child without the parents knowing. It doesn't set us up for a very engaging relationship with the family. We are seeing with the process of appropriate response or differential response that this allows us to have a much more naturally engaging, voluntary engaging process with families, and it doesn't alienate them from the beginning. It makes them more inclined to participate in and be willing to receive services from us. A study that was done not too long ago, this is so weird. It's like what I'm seeing here is different from what's over here. So, okay, but I'm gonna let you keep doing that. So a study that was done not too long ago tells us that many times the results of our work from a traditional child protective services perspective, which means opening cases, providing services, case plans, all that kind of stuff, we often do not end up reducing risk in many of those families. And part of the way we know that is we see the same families coming back multiple times. Jessica and Steve can probably give you lots of statistics about the number of repeat referrals that you have even in your state. That's a goal of an appropriate response system, is to reduce the number of families that we see coming back through that revolving door. We also don't see a lot of improvement in child functioning. There's been a big national effort to look at well-being, and what we're doing when we intervene with many families is not having a positive impact on child well-being. That's something we need to improve. It's an effort that the federal government is really focusing on. We've looked extensively at safety. We've looked extensively at permanency. There's an increased effort now to look at what are we doing to improve child well-being as a result of our intervention with families. We also know that there's many families that may receive child protective investigations, and there's data that shows that many of the moms in those families have increased depression after our involvement. So what does that say about the effectiveness of our work with families? So we have a lot of room for improvement. This is just a quote that talks about the importance of building relationships. Healing relationships are very important, and that first contact with families, when we go in with our investigator hat on, does not set us up well to establish that kind of relationship. We also know that what we need to do, and this really is what Alicia's going to focus on, is that the way to help families, you all know this as professionals, is to help them develop the skills that they need. We do not want to be involved with families until their children age out of our care and out of our systems. We want to enable them to be able to be the best parents they can be. Giving them the skill set to do that themselves is the best way to do that. That's what the focus on the protective factors does. That's what a voluntary approach using appropriate response really enables us to do. Looking back, when differential response, this effort began way back in 2003, a study was done, and we asked a number of states, why are you going forward to do an appropriate response kind of approach? Most said to improve child safety. In other words, we want to prevent having subsequent reports of abuse and neglect with families. We want to prevent that revolving door. We also want to strengthen families, and we want to keep kids with their families if at all possible. So those are, and they're not mutually exclusive goals. Safety and permanency are not mutually exclusive. They should go hand in hand. And we want to do prevention. What Lillian was saying earlier is there is a way, once we know that the family has some level of risk, our intervention can be geared towards preventing that risk from increasing by building the protective capacity, the protective factors of those families. So we won't see them come back as a subsequent report. So when we think about differential response, some of the things that I put down here are the primary reasons that we've heard and have seen in terms of the success. It's more flexible. It gives us the ability to be more flexible. As appropriate response providers, we can do things quickly with families to get them diapers, to get them a crib, to get them housing assistance, get them something that's going to allow them to not have to split up their family, to not have to take their child even in an emergency situation. So it gives us that kind of flexibility to respond and meet families' concrete needs, and then we can move into looking at, okay, what was it about how this family is managing finances that got them in the position where they couldn't afford to buy diapers today, that kind of thing. So it gives us that good flexibility. It helps us to not be adversarial. We don't go in with our investigator hat on trying to figure out who did what, or did somebody do something and when, and what do we have to prove. It allows us to give an offer of help that's not adversarial. It helps us to get underneath what's happening. As I said, we're going to solve the crisis, but we're also going to look at why did this family end up in this particular circumstance, and how can they help us to understand what's happening with their family. Get them the right services that they need. We know that appropriate response families are very receptive to receiving services when they're voluntary, when they're saying, would you like to receive these services? They are very receptive to those. And the evidence shows that more families get served overall when we have a combination of appropriate response and investigations than if we just have an investigative response. So we're getting more services in the hands of families. We're doing some things that can educate and help to engage families. We also know that there are many families that come to our attention that do not need the kind of evidence collection and the investigatory kind of process that CPS has. So we don't need to invest our time in doing that. We can move quickly into identifying the needs and providing the services. We also know that through a differential response, it helps us to build the support system of families. One of the reasons why, if I asked you to reflect on your own family, and those things that make your family successful, the things that make your family work, if you're a parent, the things that you have done, I would guess that many of you would say it's because you have a good support system. I mean, I told you that story about my husband in a lunchbox, right? But my husband is a fabulous support system for me, as is my mother and my father and my sister who has kids that are grown. So all the time when my child has been growing up and I've been traveling and doing things, I've had a support system. I've had a stand-in mom at times one of my best friends who would go to the brownie banquet for me because I couldn't be there and be the mom. So I had a support system that made my family successful. And I use that support system because I had the protective factors to know, I had the capacity to identify what I needed in order to meet my needs. That's what we're trying to accomplish with families, building that support system, those connections for families. Some of the things to just compare. It's very important. We are not throwing out the important principles of Child Protective Services. When someone makes a call to Child Protection, they make a report and they say, I have a concern about the family, we want to hear that concern and we want to act appropriately according to that concern. Safety is our absolute #1 concern. We want to immediately protect kids if they're in a situation where they need protection. We're also concerned, no less so, about permanency and well-being. So we're not abandoning those principles when we talk about appropriate response. We are saying we embrace those. We're going to look at addressing them in a little bit different approach. We also recognize that there are cases when the authority of CPS is necessary. There are cases that must go to court. There are cases that must have prosecution. We are going to identify and distinguish those cases that deserve that kind of approach versus cases that do not deserve that kind of approach. We know that there are cases where children cannot be safe with their families, at least at this point in time, and we're going to make a placement in order to keep them safe. So we're not abandoning the principles that are important in CPS kinds of practice. But we also know that many families benefit more. They are more willing to engage with a voluntary community service provider than they are with CPS. As much as I wish it weren't true, most CPS agencies around the country are not welcomed when we knock on the door of a family. We don't call them up and ask them for help. And when they come, most of us, and if all of us honestly reflected on it, we would not want to have them coming to our door. They do great work, don't get me wrong, but it is not naturally a service that we all think of, oh great, sign me up, can't wait for them to come and do a CPS investigation in my house. That's a fact. So their willingness to receive help from a community provider is just the natural. Whoops, did I go too far? Okay. Some of the things that we want to keep in mind, that circumstances and needs of families differ, and so should the response. We know that. That's one of the things when differential response got started, people started, they started saying things like one size does not fit all. We have a system that says you call, you get an investigation. But every case doesn't need an investigation. Every family does not have the same needs. So if we can individualize our assessment of families and figure out what the need is, we can make our response much more appropriate. The other things at the bottom of here, it's important that this approach that we make sure that safety is not jeopardized. I'll show you some data that shows that that's true so far, that we can put services in place quickly and families are motivated to use services. The assessment tools, Steve and Jessica are going to talk some about this later in the day. But we know that there are effective ways, mechanisms to do the right screening, and that's been the effort. We've been working with Steve and Jessica and folks now since the beginning to design a process that's used at the hotline to make sure that the right questions are asked in order to make a decision about which response a family will receive. So it's important, the assessment tools that are used are important. It's also important that we have the right training for all of our staff that are involved in this process. We know that this is collaborative. We know that this is different. At the beginning of this process, I think there was a little bit of distrust between the agency and the private providers. Are they really going to do a good job if we send this case to them? Because, we know what we're doing. We know these families. We always do it. But will they be able to serve these families? Will they ask the right questions? Will they do the right things? So that collaboration is very important. One of the other differences in differential response is only cases that get investigated and get that higher level of involvement get the entry into a state central registry, a substantiation kind of decision. That's something that can prevent people in the long run from becoming foster parents, from becoming daycare providers. So it stays with you for life. And so it's an important distinction in this process. When families are sent through an alternative response track, the practice across the country is not to make a case finding. So that's something that doesn't stay with people for the rest of their lives. And we believe it's important to have certain people entered in state registries, but not all families really need that kind of entry. Okay, so when we talk about a non-investigative approach or a CPS, differential response kind of approach, we're really talking about looking at child safety as our ultimate intervention approach. Most families want to address safety, that's their goal as well, and most families can be partnered and engaged. We're looking at more than presenting concerns. We're looking at protective factors. So all these things are important. So a couple things, I just want to put these side by side so you kind of have a sense. In a traditional CPS investigation approach, we have on the left-hand side, an identification of a child has been harmed or a child is at risk of being harmed, and we have somebody that is, we're going to hold responsible for this action. And you can see on the right-hand side, a traditional way, we have screening, we have an investigation, we do safety and risk assessments, we gather the evidence, we have a disposition, we either substantiate or we unsubstantiate in most systems. Some cases in which we substantiate would take a legal kind of a track. That's the traditional way across the country that most investigations go. For differential response, next one. And I know you can't see all the words on here. I can't hardly even see all the words on here, and I'm standing close to it. But what you'll see on the left-hand side is we're going to start out with screening the same kind of way, and there's still going to be cases that are going to be screened out. There will still be cases that don't meet our threshold at all. They don't belong in our system, okay? They don't constitute abuse or neglect. They don't meet our threshold. So those cases are still going to be screened out. But cases that get an alternative response screening, we're going to assess and determine if there's a way that we can provide voluntary services rather than going down the track where we have a disposition and we have, potential court involvement. So our voluntary cases over here on the left-hand side, where we have families receiving services, families have the option to decline those services. They're voluntary. By definition, they are voluntary, okay? But we're not making a case finding. These are cases that we don't end up going to court. These are cases in which children are not removed. Every system, including South Carolina, has built in that if a case gets sent to the alternative response track and it turns out to be a case where children are unsafe, when we get out face to face and we say what was reported was, reported, there is a way to get that case back in the investigative track. So we're not compromising safety. We're not asking our appropriate response providers to do foster care, case management, or anything like that. We're going to get those cases back into the child protection track, and we're going to do what we need in order to keep kids safe. So this just compares those two approaches. So a couple things just to talk kind of quickly through the core elements. Differential response, by definition, there's 2 or more discrete responses to reports of abuse and neglect that are screened in and accepted, as I said. There's an array of factors that helps to determine that. And this afternoon, I think you'll hear more about how the decision-making process is done here to help make that determination. Original assignments can be changed. I'm sure Steve and Jessica even have data about what percentage of cases are changed. We think that's appropriate because sometimes we don't know everything at intake. The reporter doesn't know everything, or they're for some reason not telling us everything, so we want to be able to change the track if that's necessary. It's obviously voluntary, non-investigatory response. They can accept or refuse. And these guys can tell you also more details about what happens if a family chooses to refuse or chooses not to accept services. How does that case get tracked in the system? What happens in terms of the next steps? There are usually in statute or policy in every jurisdiction, there's some well-defined set of policies. You've got those in South Carolina that define who will be accepted into an appropriate response tract. After assessment, services are voluntary. That's an important feature of this. No substantiation, as I mentioned, and in this situation, any case that goes appropriate response does not get entered into a central registry. So in South Carolina, as I said, you're going to hear about this in more detail, but the approach that South Carolina took, and this is modeled after the approach that we developed and implemented in Hawaii, which was very successful. It's been over 10 years now that they've been doing this, and there are 3 tracks at intake. There's actually 4 tracks, so there's still screening out, and then there's the investigation track. So any case in which a child at intake is determined to be unsafe, potentially unsafe, that's a case that's assigned for an investigation. And then based on the level of risk, if it's a moderate or low risk case, those cases get assigned to one of 2 appropriate response providers. Those appropriate response providers have different levels and length of service that they can serve those families. But what it does is it allows us to do exactly what Lillian said earlier. We know that there's a concern. Something has already happened. Someone has reported a concern about abuse or neglect. It's met our threshold, but we're now saying the children are not, at this point, we don't believe they're unsafe. They don't require a controlling intervention right now. The family needs some help to reduce the level of risk and prevent them from coming back into our system again. That's what the kind of approach that we're using here. Some of the things that are used in other jurisdictions to figure out the response time, sometimes they're statutory. For example, we would not want a sexual abuse case in which there is going to be criminal prosecution. That's not a case that would be going to appropriate response. So there's statutory limitations that help define. And when the early work was done here, we had the legal folks from social services involved looking at what does the statute allow us to do in terms of referrals to an appropriate response provider. The severity of the allegation. Any allegation that is serious harm to a child that has a head injury, those kinds of things, those are not the kinds of referrals that will be sent to an appropriate response provider, okay? We look at the history of past reports. That's a factor in the risk assessment system. Obviously, our focus remains on safety throughout the life of the case from intake on. And we are interested in the willingness and the capacity of the parents to participate in services. Voluntary services are dependent upon the caregivers participating with us. So we do an assessment of that. It's part of our risk assessment that we engage with looking at the family to figure out their willingness to participate with us. Important thing, assessment is very important. A lot of the training and the focus that has gone into the effort so far has been to make sure that the kinds of information that's being gathered is broad and in-depth enough that we really know the family in the assessment process. So we're making the right decision about where the family can go. That begins at intake. Some of you may, if you're mandated reporters, you may have called in. Hopefully you've noticed a difference in the quantity and quality of information that they're asking for in order to make a good screening decision. That's an important piece of the assessment process. And then the protective factors, obviously we're interested in, once we get the family into our system and we're sending them to one of our appropriate response providers, our success with them will be around building up those protective factors so that the family is able to manage without our intervention in the long run. Some of the things about engagement. We know that it's important to engage them in helping us to know them. If I was coming to your family to try to figure out how I could help you, you would obviously be a good source for me of all the things that might work for you or might not work for you, what you think is happening in your family. So all that is part of this engagement process. Collaboration with the family and their formal and informal support system, which we've talked about. One of the key things, and this is something I remember at some of the early trainings, people kind of like went, oh, are you kidding me? A differential response approach requires that we do not show up unannounced, ever. If this is a voluntary engagement and I have asked you if you would like to participate, I am going to call you up and set an appointment with you. I'm not going to show up surprise one day and talk to your kid at school. I am not going to show up one day on your porch step and just to drop in and see if I can catch you doing something. That's an important principle and foundation of an appropriate response. And what I always say to people is put yourself in shoes. If you have gotten a call from DSS and then they say, you know, we got a concern about your family, we'd like to give you the opportunity to participate in a new way that we're doing business. It's called Appropriate Response, and we have SAFI is one of our community agencies that's providing this. They will be in touch with you. And then suddenly, out of the blue, someone goes to school and talks to your kid. That doesn't feel very good, does it? You just got an opportunity. You were asked if you would like to participate. So it's a very, very important principle. It makes people nervous at first, but it has proven to be successful. It works. When we call people up and we make appointments, they are there. They're not trying to hide stuff from us. They are very happy to engage and let us know what's happening with their family, and we can set regular visits for our intervention. And we always have the opportunity, as we're going on, the providers this afternoon will talk about this. If at any time when they're out there with a family and they get a sense that there are safety concerns in that family, that there's information that's not being shared, that the children are giving clues that there's things going on here that no one is really, that is a case that comes back to DSS. Okay, so there's no question if safety is ever a concern, it comes back into the investigative system. I'm just going to go quickly through these because I know we're going to run out of time otherwise. Okay, some of the things that should be measured, and these are all things that South Carolina is looking at. One of the things, there's been a lot of great efforts in the state to begin to focus on data and what's the meaning of that and how does it help us to know whether what we're doing is working or not. Obviously, safety, we're going to keep looking at permanency. We are going to look at the reduction, hopefully, in removals and placement. We are interested in family satisfaction and cooperation. I'll show you some data for some other places about that. We're interested in looking at family functioning, some of those things I mentioned related to child well-being. The numbers of services that families receive. We'll have data that we'll be able to show about that. Worker satisfaction, this is an important one. Every place that has implemented something like this has found a great deal of satisfaction from the workers that are doing it. Especially in the alternative response providers, a lot of staff saying, this is the work I always wanted to do. This is what I really got into this business for. This feels really good, being able to work with families like this. I'll also have some data about cost savings that I'll show you. There are challenges, and I'm not going to talk too much about this, but we do. The only one I want to really mention in the middle of this is that in order to make this work, we have to have the right services for families. We engage them quickly and we say, what is it you need? What is the kind of help that you need? We've got to be able to provide that kind of help. Sometimes it's education kind of help, but sometimes it's not. Sometimes it's just the most basic kind of concrete resources that families need in order to get them, to the next step. So we've got to be able to, so that requires our system. So leadership, looking at resources that we can provide, and partnerships with, people like you and the communities and agencies that you represent are really, really important. At dinner last night, we were talking about the importance of the faith-based community. What a tremendous resource they can be in terms of providing support services and concrete resources and all those kinds of things that can help families really day to day. That's the kind of thing that we're talking about that makes this system successful. So some of the benefits, children better protected over time by engaging more parents in the process of making change. Rate of subsequent repeat reports to CPS does decrease. I'll show you some data about that. More satisfaction and cost savings. We have learned that families like having a voice. It just makes sense, doesn't it? I mean, if you were coming to my family and you were going to try to help me with something that was happening, I would want you to ask me what it was that I thought I needed and what's my experience been so far and what do I think will work. I know my family. You know your family. These families know their families. They know their history. We need to have their voice in this process. Community partnerships work. People like reaching out to their community providers for help. They like knowing that they have somewhere to go, and they like not having the label of CPS. It's nice to go to someone that's got the help that they need, but not bringing them the label. Communication is very important. I think this is why a summit like this is great, because these efforts, DSS works very hard at their piece of it, and the providers that are doing this, but this requires the whole community to be part of it. So, and the communication that's necessary to make sure that we're all communicating. When cases need to come back, they need to come back. When we see gaps in services, those are the kind of things we need to have community support and communication for. And evaluation matters, I've talked a little bit about that. This is a map that, don't ask me why that little funky thing, it's supposed to say differential response. And so I called my colleagues at the Quality Improvement Center and I said, hey, you guys, you got an updated map? Because I'm going to South Carolina and I had this old map. But this map is not even updated, right? Doesn't it have, what color is South Carolina on this map? White, right? Okay, so that means you guys aren't doing anything. That's not true. We know that's not true. You should be in the statewide category there. So I will call my friends back at the Quality Improvement Center and tell them that they need to update this map again. But this will give you a sense. There are quite a few states in that darkest reddish kind of color that are statewide. We've got regional county implementation. The yellow ones are supposedly planning or considering. The dots are tribal ones. And then there are some states that have what they're calling a screen out response, which is states that are just doing not the full-blown investigative referral, when they're taking cases that would normally be screened out and doing a focused preventive kind of effort. So it's a little bit different than a true differential response. So I will ask them to update this. This is a list of the kinds of services that we find are provided most commonly across appropriate response systems. Concrete services, clothing, food, utility, payments for utilities or other things like that, housing, job training, transportation, and a lot of other things. What's important about this list is that we're talking about just concrete services. We see domestic violence services, mental health services. These are families that have needs. We're talking about moderate and low risk cases. They have needs. There are situations in which they have substance abuse problems. They have not reached the point where they are resulting in their children being unsafe. And our goal is to prevent them from reaching that stage. So the array of services that the appropriate response providers have access to can address these kinds of service areas. So that's an important thing. Just a couple things about evaluation, and there's a whole lot of resources on evaluation. I'm happy to tell you where to find them. But everyone that's looked at safety, safety has not been compromised in the implementation of a differential response system, meaning we don't see families that we refer to appropriate response, we do not see them coming back as subsequent referrals at any higher rate than we do in our investigative side of the system, usually coming back at a lower rate, which is what we'd be hoping for. Increased services, we see families getting more services. When we simply count the number of families that get served, it's higher when we have this combination of array. More often, their provided services, the number of services they receive is greater, and they get them earlier. In our differential response data that we look at, we often see that families get engaged right away. The services that they get provided through the appropriate response providers happens more quickly than if we put them through the investigative system where it takes time and we have court and we have assessments and we have a referral here and a referral there. It takes a lot longer. Family satisfaction is greater in appropriate response. There's a number of studies that show that families reported greater satisfaction when they were served through an appropriate response. And there are 2 studies now. This one says Minnesota study only, but there's a second study that's been done that shows in the long run it is cost effective. So the amount of money that's invested in upfront in providing appropriate response in the long run pays off because we see fewer of those families ending up with subsequent investigations or kids in placement, which we know are expensive kinds of services. So, and then I just want to show you one slide. This is from Hawaii. This is the only finding we found so far related to disproportionality. Hawaii, traditionally, before we started with appropriate response, had the placement of Native Hawaiian or part Hawaiian was higher than white kids in Hawaii. And as a result of the implementation of differential response, you can see that red line. That's the Native Hawaiian removals went down significantly as a result of differential response. They now they're one of the few, I think the only one that I'm aware of, state that does not have disproportionate entry of their minority children into care. That's attributable to the fact that they have these community providers that are providing services to families and not having to remove kids, keeping them safe in their homes, keeping them served in their communities.